If everyone's set, get going. Cam, you ready over there? All right, I'm just checking. So today marks 347 days since our first case of COVID-19 in Albany County. We're now in our 49th week, believe it or not, getting close to the 1-year marker. It's been a long 12 months for a lot of people. Our death toll stands at 345 since the outbreak started. And the last time we reported a COVID-19 death was February 17th. Sadly, though, the U.S. hit another tragic milestone. There's been now 500,000 COVID-19 deaths in the United States. We hit the 500,000 marker, which is sad. So my prayers and thoughts go out to all them families. That's more than the combination population of Albany County, Schenectady County and Rensselaer County combined, if you want to put it that way. As of today, we have now 20,048 cases of COVID-19 in the county to date. That's an increase of 58 positive cases since yesterday. We announced 67 new positives the day before, and the day before that was 73. Our 5-day average now is positive is 71. Yesterday it was 70.6. 70.6, yes, correct. There are currently 1,519 people under mandatory quarantine. Yesterday that number was 1,644. So we had a nice big drop in that, which is good, people recovering. We have 4 out of the cases from yesterday, 14 have had close contact to a positive case. 4 healthcare workers, 40 don't have a clear source infection at this time. As of today, 62,496 people now have completed quarantine. Of those, 19,479 were positive for COVID-19 and have recovered, which is good. That's an increase of 75 recoveries since yesterday. There are 8 new hospitalizations overnight. There are currently 62 county residents that are hospitalized from this virus. Yesterday that number was 57. There are 8 patients currently in the ICU. Yesterday that was 7 in the ICU. Albany County 7-day average right now is down to 1.6. We have not been there in a long time. So 1.6, thank you to everyone doing the right thing, wearing a mask, coughing into your arm, cleaning your hands, and staying 6 feet apart, because it's working. And I know it's been difficult for a lot of people, but this is working. The proof's in the numbers. The testing numbers are still up there. So we're getting there. We're getting there. The light's at the end of the tunnel. We just need to continue to do the right thing. 4 days ago at our last briefing, it was 2%. The Capital Region 7-day average is now down to 1.9 from 2.1 4 days ago. The last time Albany County 7-day average for a percent positive rate was this low was October 31st. The Capital Region's hospital capacity is at 35%. If you remember, not too long ago, we were at 24 a couple weeks ago. So that's good. Our ICU beds are at 28%, so which is also good. And these are another thing, step in the right directions, and that's what a lot of this stuff's based on. These numbers are encouraging because of that, because the majority of nursing home residents have been vaccinated. We're happy to see that the governor has opened up visitations and will resume under his guidance. We're waiting from that from the CDC. I do imagine you're going to have to give a COVID-19 test beforehand, so please go to our website. You can see where that's available. So you can come to the nursing home and show them that you are negative for COVID-19 to get people back into this. And you got to remember, majority of our residents have gotten the vaccine. The new ones that are at the nursing home, that unfortunately now are at our nursing home, that they might not have it, and there's still some workers that don't. So we still got to be careful. Still got to wear your mask. We still got to socially distance, but it's going to be so much joy to the residents there and for the families to get together with their loved ones that they haven't seen in a year, haven't been able to physically. They see them, physically touch them, and we still want to keep your 6 feet, but get to see that person you haven't been able to see face to face is going to be good for the resident. It's going to be good for the family and everyone involved, especially the staff at our nursing home who have become like family to these residents. Because they've been taking such good care of them. Things are starting to open up, which is good. I had the opportunity yesterday. I had some time off, and my daughter brought me to go get shoes. Well, I didn't think that was going to be a couple-hour production, but I should have known better. And after going to a couple places, I got to, we were at Famous Footwear, Colony Center. I got to meet this girl, Christina, and the staff there were great, had a lot of questions, and I was a little embarrassed. My daughter was giving me a hard time about it, but again, it was nice to the people that were there, and seeing people out, you know, and doing the right thing, wearing your mask, socially distancing, and all the protocols that are in place to make shopping that much safer when you're out. So Colony Center and Crossgate's just doing a great job, and all the businesses that I kind of ventured around a little bit to see how things were going, and we got it down pat. It's been 12 months, so we're all in this together. I was also happy to see that indoor family entertainment centers and indoor amusement parks can open up starting March 26th at 25% capacity. Outdoor amusement parks will be allowed to reopen starting April 9th at 33% capacity. Why axe throwing was thrown off of that, I don't know. I read the Chris Churchill story. Don't know why that was left off. It should be on there. We're gonna push to get that on there. But again, please, everyone, continue to do the right thing, and hopefully as more vaccine gets here, we can get more shots in arms and continue to get everyone vaccinated so we can get back to some type of normalcy again. But it's going to take time. You've got to be patient. Continue to wear your mask and cough into your arm and clean your hands and stay 6 feet apart, and we're going to get through this. Even though our numbers are improving overall, we reported on Friday over the weekend that there's 2 cases of the UK variant identified in Albany County. We're also seeing reports of the South African variant being identified in New York for the first time in New York City and Long Island. These strains are more contagious and more easily spread, so we need to continue to protect ourselves and others and follow the health guidelines. Dr. Whalen will talk a little bit more on that, but still the information's coming in from that, so we still trying to figure everything out about the UK, the 2 people that had the UK virus, and where it's going from there. So those who want to get vaccinated or check their eligibility, please continue to use the state's website and their hotline, 1-833-697-4829. United Way, 211, thank you to everyone at United Way making it simple and easy. Not everyone can navigate the web. Also want to remind, we launched our new pre-registration tool so people can sign up. It's easy contact. They can have a vaccine clinic, or when Mohawk is going out for delivery of vaccines. One of the good things is the pre-registration that we're doing, the state's going to use it for the Washington Armory. One of the questions we brought up in the control room, what about Schenectady and Rensselaer County when they fall in that zip code? But for right now, everyone that pre-register on that, they will be taking names off of that. So you'll be getting it from our side and from that side if you qualify. But there's more guidance that will be out on that. I know the registration's starting up soon, so please pay attention. But you can find the link at Albany County's website, albanycounty.com. And again, it's a great partnership with a variety of organizations in the city to make sure this happens and people can get pre-registered. We've been seeing the impact this is having on the minority community, so I'm glad to see that this is up and running. It was the same reason why we partnered with Mayor Sheen and Mohawk Ambulance to get into these underlying communities, to get vaccines in arms. And to people that don't want to register, don't have internet access, I think the Common Council of the City of Albany just had a great story. They did a study a couple of years ago. Derek Johnson talked about from the school district side, kids in the South End are having a hard time with computers. So we have to make it simple, people. And by having Mohawk Ambulance and that partnership we launched 4 weeks ago, over 65% of the vaccine that got out were in minority communities, with minorities. It was a huge success. We just need the state to give us more vaccine. I know Dr. Whalen goes through the vaccine, and we're trying to do what we can to partner with Mohawk to get more vaccine. And one of the things we cannot continue to forget is the people that can't get out. The people that can't get out of their house, they're not mobile, or they just don't have the means for transportation, or they're too sick to get on a bus, or they don't want to get an Uber or Lyft. That was one of the reasons we set up Mohawk Ambulance, so we can do that, so we can get shots to people at their residence, because that's going to be a big issue, and we need to address that. And I brought this up to General Murphy, and I will continue to bring this up to Larry Swartz, which I did yesterday, talking to him on the phone. We need to address this issue with people that are homebound, and that's where Mohawk falls into place. I'm glad Sheriff Apple and his team are, with their vaccine every week, are going out and doing this at people's houses. We need to continue to do this in a partnership, because these are a vital community of people that don't get out, and the only way we're going to do this is by partnering together in a partnership to make sure the left hand knows what the right hand's doing to move forward. So when the Washington Army, just switch gears a little bit, opens up, and you'll be able to start signing up to get their shots. Appointments will begin March 3rd. Those within the zip codes will be prioritized first, and it opens up to 12202, 12206, 12207, 12209, and 12210. Again, you got to be patient with the zip codes, and it's for minority communities first, the black and brown community. That's where we need to get the vaccine, and then over time it'll be left out. But within that zip code, people that live in that zip code. More guidance is coming out, so please stay patient. Continue to read what the State Department of Health puts out, and then as we find out what more falls into them zip codes, we'll put it out also. But again, thank you to President Biden and Governor Cuomo for making this happen. This is going to be a huge thing, 1,000 vaccines a day, 7,000 a week on top of what we're doing. So again, please be patient. Everyone, we've been there. It's been almost 12 months. We got to continue to stay patient. Due to the vaccine shipping delays around the country after the winter storm last week, we had to postpone our vaccine pod in our clinic last Thursday. We were starting to reschedule our pods, but we have to wait to see how much vaccine comes in. You got to be patient with us. Dr. Whalen will talk about that. We got to find out what has happened with our vaccine. So we were supposed to get double the doses. When I talked to Larry Swartz yesterday, we were supposed to get double the doses this week to make up for last week. We did not. We got the doses for people that are getting their second shot on top of our 800 that we get every week. So I don't know if they're just waiting. I've heard different things that the vaccine that's coming in Tuesday and Wednesday was the stuff we were supposed to get last week, and we might get this stuff in Thursday, Friday. But we're hoping. We're planning logistically a huge pod. Dr. Whalen and her team, I encourage the press to come down and see what the job they do at the Times Union Center. It's unbelievable the amount of people they can push through in a short time. So if we do get double the vaccine, or if it comes at the end of the week, I'm sure Dr. Whalen and her team will get it out there, because that's what they do. But again, we did not. I know that's been said to the press that we were going to get double the vaccine. Everyone was. We have not have confirmation. Until we do, can't put it out there. Be patient with us. So again, be patient. But Dr. Whalen.
Good morning. So lots of updates today. First of all, the number of cases that we have in the county continues to decline, so that's good news, and we're following that on a daily basis and hoping that this means that we will continue to see less coronavirus in Albany County in the coming days and weeks. However, as we reported, we have had identification of our first 2 cases of the UK variant in Albany County. These cases were identified in a congregate youth facility. Both cases were teenagers, and both of them were asymptomatic. The testing was done after an initial case at the facility was identified, and a larger testing was conducted by the state. In response to the information that we received late Friday afternoon, we learned that there is going to be additional testing at that facility conducted today and by the state, and hopefully we'll have more information and updates on that at this time. At this time, there have been 82 cases of the UK variant identified previously in 17 counties throughout the state, and Albany County now makes it 18 counties around the state, according to communication that I had with the state this weekend. So I know we've discussed before the concerns of the evolution of the epidemiology of these strains, and there have been predictions that by late March the predominant strain could be the UK variant. So this is of concern because, as we know, this strain of the virus is more contagious and could likely result in more infections. So from that perspective, again, it's important for people to not lose sight of the protective measures to ourselves, including masking and double masking in some circumstances, and including hand washing, avoidance of large gatherings. Everything that we have set up to now continues to be important, and it continues to be essential, especially if we are going to be dealing with more contagious variants. The South African variant was identified in Nassau County. I believe that's the first case in the state, but of course we are going to continue to watch that as well, and our colleagues at the Wadsworth lab are continuing to do this testing to determine the prevalence of these strains throughout the state. So that's something that we think is important. I think is very important in terms of a note of caution going forward. In terms of vaccine, I have some happy news to report. This morning, just as I was coming into the press conference, I learned that we have received 2,900 doses of vaccine this morning. So we will be looking at scheduling our second dose clinic that was canceled last week. So people that were due for their second dose, we will schedule that this Wednesday at the TU Center. That will be from 4 to 7. We will be sending out information for those that were due that second dose of vaccine via email. People will be getting robocalls, and we'll be posting it on our website. So if you were due for that second dose of vaccine last week, please ensure that you're checking your email, you're listening to your phone messages, and you're looking at our website so that we can see you on Wednesday evening at the TU Center. We will be looking at having 2 clinics on Thursday. One will be for our first dose, and the second will be for our second dose that is due on that day. The first dose, we anticipate that we will release the link to sign up tomorrow at 5, as we have done in previous weeks. I will share with everyone that we are working with the state to ensure vaccine equity, and the list that has been developed, we are working with communities that we know are vulnerable to identify individuals to attend our pod, as well as those of you that have signed up on the list. But there will still be availability for those that want to go on the website and sign up Tuesday evening to do so. The information around the state and the state site that's going to be on Washington Avenue was discussed last week by the governor, and this location has been targeted especially so that we can see more of our minority communities attend clinics. And to that end, the pre-registration this week to open up next week's scheduling is limited by zip code, and these are zip codes that have been identified as high needs, as high social vulnerability index, and as we've discussed previously, it is important and essential for us to ensure that we are serving the communities that are disproportionately affected by COVID disease. So as the county executive indicated, the sign-up will be via 12202, 12206, 12210, 12209, 12207, and 12222. Those will be up on our website, and the link as well to sign up for that, to pre-register, is also on the website. The state has assured us that they will be working with the list that we have previously developed, and that we will be looking at people to continue to sign up. So we urge those that are working in communities, that are part of community-based organizations in these zip codes, that are part of government in these zip codes, to work with people to ensure that sign-up can occur this week. This limited zip code sign up, I believe, is for the first week of the clinic, and after that will be opened up to the to others. There are also zip codes that have been targeted in Schenectady and Troy that will be part of that first week's efforts. So all of those will be listed on our website. So we look forward to continuing to work to get the vaccine out and get it out in a timely fashion. We are still looking to get the 1,300 doses that we were scheduled to get last week, and we received information over the weekend that we could anticipate those late this week. So we will be looking for that shipment. Once the shipment is in, we will be talking about scheduling an additional pod to make sure that we get that vaccine out to the eligible populations within the week. And again, for eligibility for our vaccine clinic, it is still the 1B essential worker population and individuals who have comorbidities that meet the criteria that's listed on our website. So we look forward to continuing to work with all of you to get vaccine out. I think this coming month there is going to be a tremendous increase in the amount of vaccine available in the capital region. Again, I urge people to get vaccinated when it is your turn to be vaccinated. This vaccine is safe and effective, and will protect you from getting serious disease, from being hospitalized, and in some cases it could save your life. So please consider getting the vaccine when it's your turn, and we look forward to seeing you hopefully at our clinic or at the Washington Avenue site. Thanks.
Thank you, Dr. Whalen, and thank you to you and your team. So again, we encourage people, please go out, get tested for COVID-19. Go to the Whitney Young. It's free. If you don't have insurance, you can go to Albany. It's free. You don't even need insurance to go to Albany, and we'll cover the cost. We encourage people to go out and continue to get tested, continue to do the right thing, but you can call Whitney Young for an appointment, 518-465-4771. And Albany, as always, 1-888-364-3065. Please go to our albanycounty.com. You can go to our website and you can look at whether or not you qualify for different variants of this vaccine. Like Dr. Whalen said, we still are on the 1B with teachers and stuff like that, other than if you have underlying health issues, which it doesn't matter what age group you are in, she can do that. So again, it's there, it's available. Wait your turn, but you got to help educate yourself a little bit too on this to really see about where you fall in these categories. I know there's been a lot of issues with a lot of different workers, essential workers, especially here in the county, that come to work every day that don't fall in that category. I don't know. I didn't make up the rules with the CDC or the governor or Department of Health that came out with this. I don't know how they classify certain people that fall into different categories. I know the priority from the president and everyone else is to get teachers back in the classroom so we can get kids back in the classroom, because there's still, unfortunately, a lot of kids that have been virtual since last March. Some schools are trying, but as you can tell, it changes, and some days they're open, and if they get an outbreak, then they got to shut down, which I know Dr. Whalen's going to, I think this week you're going to talk about some new guidance on that, and again, got to be patient. And people that I know who want it, I'm not going to argue with you. A grocery bagger versus someone else, I get it. I get it. A taxi cab driver or a Lyft or a Uber, or whatever it is, that Grubhub that delivers food. I don't know. I don't know how they fell in it versus somebody that's on the front line in DSS every day. Or DCYF, or out doing their job, and how they don't categorize. But you got to be patient, because every shot we get into someone's arm is closer to being open and back to the way things were to a degree. People that need mental health support is available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. And our 24-hour sexual assault hotline, as always, 518-447-7716. 201 in the New York State hotline. And please, everyone, stay safe out there. Wear your mask. Cough into your arms. Clean your hands. 6 feet apart. We're getting through this. Our numbers are going down. And hopefully by the summer we can just kind of start getting past all this. Any questions?
Guidance from the state DOH says that at the end of week 9, I believe, eligibility in hospital settings is supposed to open up beyond healthcare workers. Have you heard anything about that or the execution of that?
I'm sorry, you're asking if guidance hospital workers?
Vaccine distribution in hospitals is supposed to expand beyond healthcare workers at this point. I wasn't sure if you had heard anything about that or if any local hospitals are doing that.
So I think that a lot of the hospitals, when they originally were allocated vaccine, were vaccinating many of their employees. The hospitals have been limited in the amount of vaccine that they've received in the last few weeks, and they are trying to ensure that all their essential workers are vaccinated, but I have not heard any additional expansion of that category.
I know the vaccine was supposed to be shipped from the hospitals to like the health departments and other pods across the state of New York. We haven't heard either. I know they announced that a couple weeks ago that they were going to shift. The hospitals had one more week to vaccinate their workers, and then it was going to shift out of there and the vaccine was going to be taken out, but we have not seen that.
I know you mentioned that the congregate youth setting where the variant was found will be doing more testing in the facility. Will there also be expanded testing in the community, or do you urge people to get tested, kind of like Saratoga County did when the variant was found, because you're not sure how much it's spread?
Right. So, I know when it occurred in Saratoga, because it was a public-facing place, they were looking at individuals who may have attended there to be tested if they had any concerns. In this particular situation, there has been a contact investigation done for both cases, and in that situation, the same information would be imparted as we usually do to people, that if you have been in contact with a case and you are concerned, it's a good idea to get tested. So that information has been shared, and then if we learn any more with additional cases, that may be expanded.
You also mentioned that the 2 teens who did test for this were asymptomatic. Do you know what led them to run the lab work to find out if it was this variant, especially if, or what caused them to even be tested in the first place if they were asymptomatic, and what should people look out for symptom-wise?
Right. So, the symptoms with the variant, with the UK variant, don't change that much. The hallmark of that variant is that it's more contagious. There was testing at the facility because a previous resident had tested positive. So because of that, they decided to do a little bit more testing of individuals who may have come in contact with the first individual. And we know that in younger age groups, there's a really high prevalence of mild disease and sometimes asymptomatic disease. So this is not unusual from what we see in the general population, but obviously the concern is with the spread of this that it could affect more vulnerable individuals and cause, more serious complications.
And is there a difference between the UK variant and the South African variant? I know the South African's not here, but how do they compare?
So the South African variant is a little bit more concerning because it has shown to result in more severe clinical disease. So it is different from the UK variant in that way.
I know that Governor Cuomo talked about schools and trying to get kids back for in-person learning. You mentioned it last week as well. Is there really anything locally that could change much? I mean, I know he's pushing to get kids back for in-person, but if schools are doing a hybrid, they still can't really change much because of social distancing in the classroom. So I guess where do you go from that point?
So I think that the schools have, and I know I've said this so many times, they've really done a good job of trying to ensure that kids that are in the classroom are well protected, and the kids are wearing masks and the kids are staying distant, and we really are not seeing high levels of disease within the school community. So that's good news. And also we're starting to see a lot more teachers be fully vaccinated. So I think with that comes comfort level of the staff and administration to come back into classrooms. In terms of parents, we can continue to assert that we feel that the schools are currently a low-risk scenario, and in fact, not universally, but many children who are socializing because they are not in school may have a higher risk of contracting COVID outside of school than they might inside of school. So we had made a policy change, which was sent out to the schools on Friday, about quarantine policy. And previously, we had been acting out of, an abundance of caution and about not really knowing what the epidemiology in schools would be, to quarantine classrooms when there was a positive case. And we watched this for weeks, and we watched, what the behavior was within the schools and what the rates were in the schools. And as we started to see our cases in the schools drop from, in the 30s and 40s down to a handful of cases every week, it seemed to make sense to change the policy, then to look more in terms of proximity. So looking at where the child was seated, and the schools have been very proactive in expressing that they were willing to work with us on individual cases to ensure that just the close contacts would be quarantined. So hopefully this will enable more comfort for parents sending kids to school. I know kids have gotten to the point where they, don't want to take a chance of going to school, that they may be quarantined for a couple of weeks. So I think that this is another important step in getting kids back to that in-person learning environment. We really know that that is the best place for them, and that there are so many other untoward effects, negative effects of the school-age population to be out of school, that I think it's time that we make that shift.
Any other questions?
I'm hearing from colleagues of mine that there's word of a professional lacrosse league coming to the Times Union Center. Is that something that you can talk about? Or am I hearing wrong?
I can't talk about it at this point in time.
Okay.
Any other questions? Thank you, everyone. Stay safe out there. Wear your mask.